Hello, everyone, and thank you for joining today's webinar. We've been holding these webinars as an opportunity for you to get to know our grantees and also to learn a little bit more about our programming. Joining us today is going to be Dr. Itengre Wadrego, the CEO of ARENA, the NGO in Burkina Faso that is our partner for all that we do there. Dr. Itengre, you'll remember, is the FIGO certified fistula surgeon who used to be the medical director of Danja Fistula Center before opening his own NGO in ARENA. So let's speak to Dr. Itengre. Well, welcome, Dr. Itengre. It's good to see you.
Thank you, sir. Thank you, Soja.
So when I explained to our supporters at the end of last year that your equipment container had arrived and you were getting ready to set up ARENA, they had a lot of questions. But first, several of them have asked me about your safety. They heard about the coup d'etat that happened in Burkina. So could you first tell us a little bit about how that's affected you and how you're doing?
First of all, thank you very much for giving me the opportunity to talk about that. Right now, I'm doing very well, and I am seeing that and everything is calm here. People are very quiet. And really, even the same day of the coup, the people went at work. So we haven't seen big manifestation around the country. So everything is calm.
And do you see this affecting your timeline for opening the clinic and what you have planned for this first quarter?
Oh yeah, this is a big point because with this process now, you have everything in the ministries has stopped. So we need to wait and see the new rulers, how they will work, who they will put there, and then the process will go again. So in that case, yes, we will experience some delay, and according to what we have planned before.
When you and I spoke before, you talked about the need for various inspections and sign off and things like that by the Ministry of Health. So that's what you're talking about in terms of delay.
Yes, normally, because like right now for our clinic, we need a final authorization to open and function normally. And normally this authorization is signed by the Minister of Health. And we need to get the clinic organized, all the department organized, get our big equipment there, get at least the necessary staff that we need, and other paperwork as introducing the normal credential for the staff, so that they will come inspect the clinic, and then they can give us their okay to continue. And we are working right now on that.
Okay. Well, I'm sure our supporters are very happy to hear that everyone is safe and things are calm. So tell us a little bit more about all the work that you're doing now with the equipment and installing it, and how is that going?
Well, as you know, this is it was very exciting to finally receive the container with the equipment, and we were very happy. And we unloaded the equipment and we put it into the clinic. So the first time we started doing what we can do, like putting aside the consumables and medicines. And we got a team of biomedical technician. So they started yesterday. They started their work yesterday, seeing the equipment that we have and trying to check and begin the installation process. So this is the equipment side, and we are very happy because up to now, the technicians are very happy with our equipment, and we are really excited about that. The other side is the staff that maybe you know, because we have started, thanks to the support, to your support, with some staff before this time. And so we have some nurses already working with us, and we are trying to formalize their affiliation to ARENA in preparation for the work and the clinic. So, and of course, the rest of the paperwork goes along with, because every staff need to make sure that they have the needed credentials so that we can introduce it.
That was actually one of the questions on my list from the supporters who had asked about this was, how do you go about finding the proper staffing, and how is that process going for you? Are you fully staffed for the opening eventually of ARENA? And what's your timeline now for when ARENA is going to open?
We are still expecting that maybe by end of March, we will be able to get the authorization and open. That means probably we will fully start doing surgery there, and by the second quarter. These are our expectations, and we still believe it is possible. Yeah, seeing how things are going in the country with the new government, we believe in this timeline is still possible to get the authorization. Now, how we have gone to get the right staff, this is a very interesting question. One thing we did was to say, okay, it's not just about finding qualified staff, but we need staff that have a heart for fistula patients. And we have had some nurses working with us since our beginnings, like volunteers, and they have been with us, and we have had time to observe them. And so some of them has made the interest to work with us, to work with our fistula patient. And of course, we believe they have the right to be the first people to be considered for that. For example, we have a medical doctor who has been working with us like a volunteer, like for 2 years now. And we have been sending him in villages for community outreach activity. And he is very good in clinical care. So he has been considered to be like our permanent general doctor in the clinic. Now, there are some stuff that we will need for partial time. Like for example, we have a ultrasound machine, and we will need a radiologist partial time to come and check for complex cases when we need. And other stuff like laboratory technician, that we have a plan to recruit a full-time technician for this year. But we believe since we are starting now, it will be wiser to start with a partial time technician and see how we move forward. And the rest of the staff are, to make sure we get the clinic very clean, we need some cleaners. We need to make sure security is there for our ladies, and we already have our security guard there. So we have an administrative assistant. And of course, we are collaborating with other doctors that are not part of the staff, but they are collaborating with us.
What has been the reaction of the community seeing this clinic built and seeing all the activity going around? How have they engaged with you?
Well, this is very interesting because, in the nearest area, we don't have really a very big clinic. There is a private clinic like maybe 4 kilometers from here, but very private and expensive for some people from the community. And since most of people around know that we are working with fistula patient and women that have suffered childbirth injury, they were very excited to know that we will open a clinic here, especially because they know we will be offering some other services that they could benefit from. So it is very exciting. I remember the day we were unloading the container, we got help from the young people from the community. So that was very, very, very exciting. And even today we were again working, we got help from younger people there. We get help from ladies to clean when there is need. So they are very excited to know that they will have a clinic around.
So a follow-up question to that, to the engagement with the community, someone had asked about partnerships. So what organizations and entities are you partnered with in Burkina for ARENA?
Well, here our first partner, of course, is the Ministry of Health. And we are following the policy of the Ministry of Health regarding the program for women with childbirth injury or globally maternal health. But we work with other partners and like health center. We work in the Sahel area. We work with the hospital of Gorom Gorom. This is a very, they are mainly nomadic people, but we have a volunteer there that are doing community-based activity, educating community leaders and recruiting patients for us here. See, this is one of our partners. We are partnering with another local organization in Boromo. They have experience in community-based activity too. That's helping with community leader education and recruitment too. And here in Ouagadougou, we have our partner, Fondation Rama. They do recruitment and they do social reintegration too. So, and of course, we have one of our bigger partners is the teaching hospital of Bobo Dioulasso, where we are developing a training program for residents in urology and gynecology and obstetric fistula surgery. So these are most of the main partners here locally. And I'm sorry, I forgot to say that, we are trying to make a program for to educate midwife, birth attendant, and nurses, not only in obstetric fistula, but in safe food and maternal health globally. So, and in this case, we are starting to collaborate with the Association of Midwives so that we can move forward with this program.
Well, it sounds like you've done a lot of outreach and a lot of engaging with other stakeholders in the community to try to get them to understand what their role could be, and that's really terrific. Now, one of the questions that people that had been asked of me was regarding what happens to the women now while you're setting up your clinic? What about the women who need surgery now? Are you still doing surgeries?
Oh yeah, this is why we have been really busy, because while we work here and getting the clinic organized, we have kept doing surgery at Larieve. So when we have patients ready, we continue to do surgery, and we take the other part of the time to work in the organization here.
That sounds like I know you have a very busy schedule, but I want our supporters to understand all the stuff that you're working on. So you're doing surgeries, how many days a week? And you're working on putting the clinic together, how many days a week?
Well, we do surgery 2 days a week, but then we have 1 day for, like, when we admit them into the clinic, I need to be there for the screening. So this is 3-day clinic, fully clinical side. And I have the 2 days to look at the clinic and see how things goes there. So, but I'm happy that, the rest of the team is supporting very well. And that's a very good thing. And we are getting help from our colleague from the mission here, and they come to help too. So that's very encouraging. But yes, it is a very busy schedule.
What's the biggest advantage for a woman getting services at the new clinic versus with places where you were sharing space?
My philosophy is that if we are able to fight for a patient with cancer to get the best treatment for him, we need to do the same fight for the fistula patient. And in that case, I think treating the woman in the dedicated fistula center give the opportunity to have not only a very stable surgeon on site, but also to have a very good nursing care team. And that is very important. And that would make a difference. Because when for example, we were working the other side, of course, we are doing follow-up and everything the patient needs. But it's not the same thing when you bring them to a dedicated fistula center where all the staff is trained and focused on the care of fistula patient, not only clinically, but also taking part in their social and the social aspect of their life. So I personally believe there is a very big difference, and there is an advantage to have this clinic for these ladies.
Regarding reintegration, so I know that you've been doing some social reintegration services at Larry Ebert Clinic Medical Center, where you've been doing surgeries up until now. But what are your plans for social reintegration at the new center?
Well, in the new center, our expectation is to develop two ways of doing social reintegration. At Larry Ebert, we were doing very short training, taking the opportunity that they are there in the clinic, and we were doing education. So we are planning to keep doing education because we found out it's very important, and it gives us opportunity to create ambassadors among fistula patients. We will also continue to give short training for those who are interested, but we will find the space to develop longer term training. But the other way we wanted to do is to start developing working group or solidarity group in some areas in the country. And we have started in the north and in the center north. And the idea is after surgery, all the ladies that are coming from that area will join this group. So they will be trained in the community, not in the hospital, but in the community. And this is really in order to adapt what they are doing to the real need in the community. And of course, we will keep collaborating with our partners like Fondation Rama, because they have other ways of doing social reintegration. And when they send us patients, we do the surgery and we collaborate with them to develop the social reintegration. The other side of social reintegration here is that we have found that some ladies were having doing small cells in the community, and they lose all of that. So when we evaluate with them and they are able to restart, what we contribute with a certain amount of money for them to relaunch after they return into the community. And we are following with some of them, and they are doing very well. So we are planning to develop this side of the social integration.
So when you say they were doing small sales, they had some sort of business that they were running, that they lost.
Yes.
So could you give us some examples of things like that?
Yeah, some some people used to sell they have small boutiques in their villages. some people, some women used to sell food in their villages, but has expected when they have the fistula, nobody else want to buy their food. So they lose everything they were doing. We have had example of women that used to be part of some kind of solidarity group where they used to get money from other people. And when they get the fistula, they are excluded from the group. So, but we believe they still have the capability to develop the business again. So we are trying to look at this lady and try to keep them with this kind of business.
You're talking about providing them additional training or providing them small seed funds or?
Yeah, like they need, of course, training. And we have made the experience in the last quarter of 2021, training 18 women in entrepreneurship. And we found out that they need it because most of them are doing business, but they don't really know how to do it. And they don't have any knowledge about accounting or other things. So they need a training. When we define the ladies that we want to support for this kind of business, we will give them a short training for that. And then we will give them a sheet with a small amount of money so that they can launch again in the village.
So it sounds like you have these women who are fully capable of having these small businesses, but when there's some sort of issue, they don't have the business background understanding in order to adjust.
Yes.
So training people in that. And are you bringing in special like lecture teachers to teach that, or how are you doing that?
We are bringing people that are specialists in that area. So they organize how they will give the training at the level that our lady can understand.
That's very exciting. I know that you've been on several calls that we've had with Sarah and Alice also, and you know that they do solidarity groups and are very successful with that. So hopefully the three of you, hopefully you can learn more about their programs also, and that will help you too. So as you've been setting up the clinic, and as you've been trying to get to opening your own place, have you met any additional challenges that you weren't expecting? It sounds like you expected there would be, you and I have talked a lot about the administrative aspects of going through different government agencies in order to get things done. So that's a known, but are there other unknown challenges that have come up during this process?
Yeah, it is always good to look at things from outside because when you get inside, it is very difficult. And even yesterday, I was talking with a colleague of mine, and I was remembering, and I say, you know what, I'm really thankful to Soja because I have learned a lot from her. And, organizing, settling a clinic is not really easy. And you think maybe you have everything you need, but you find out that you still need other things. And a simple thing is I'm a surgeon. And, when I get there and I plan everything, but then I have the operation room nurse that's come and say, hey, I need this thing to be in this side. And, we need to go back to that because he will say, this is my specialty and I need it this way. And these are the kind of challenges we face. And we had a friend of mine came from Germany. She's an operation room nurse. And when she came, she went there, she visited, and she said, oh, here this is what you need. And I said, look, we cannot do that this way. And she said, no, but you need it because this is not your specialty. We, the operation room nurses, we know that you need it. And these are the kind of challenges we face with different specialists when they come to visit. This is one of the things. Another challenge is the staff. As I said, we are trying to find staff that have the heart for fistula patient. And the other challenges are even the equipment. When we receive the equipment, we said, oh, these equipment are from the US. And most equipment used in this country are from Europe or China. So we had the challenge to find the biotechnical, biomedical technician, because we needed somebody who knew about American equipment. We don't want to take the risk of getting into trouble with the equipment.
It sounds like, so you're used to being the fistula surgeon and having control over everything in the environment for you to do surgery. But now that you're the CEO of Arena, there are many different areas that you have to learn how to do correctly, right?
Yeah, I'm learning how to do shared leadership. So I need to depend on various people that are, the collaboration is perfect, but I need to really share the leadership responsibility with them so that we can move forward.
Would that be the advice that you would give someone who's trying to open a new clinic somewhere, making the transition to a CEO of an NGO? What would your advice?
Yeah, I would advise to find a very good team of specialists and then try to get them work and just depend on them. Like I finally told my operation room nurse, look, you are the boss here and you will just tell us what to do. If I need something else, I will tell you, but you are the one who should know what to do here. So, and you know, I found out that it was really great. I left Rasmata, tried to organize all the consumable and everything. And I found out that they did it better than I would do. So this is a very good advice that I would give to other people.
So from being a fistula surgeon to being CEO, how many staff do you have under you now that you manage?
Around 10, between nurses, medical doctors, and the other staff. But it is just like, you know, and what we did is in every area has the responsible there. For example, for communication, we have a focal point for communication, and he is the one who would advise us. For nursing care, we have a focal point who would advise us. And for medical care, I give my advices because I'm a fistula surgeon. I know what to do things, but I have the general doctors that I'm trying to push and get him to know how things go.
Is there anything else that you want our donors to know about what's going on in Burkina Faso, how things are progressing?
Oh, yes, I would first of all give a lot of thanks to them for contributing to the treatment of fistula patients, and especially for contributing to treat fistula patients in Burkina Faso. Because as you can see by my report and everything, obstetric fistula is still a big problem in Burkina Faso. And we are in lack of dedicated fistula centers. There are fistula surgery being done, but at general hospitals. So I think the one we are going to open is like a very good gift to the country. And I would like to tell them also that, you know, their support is really meaningful, and we on the ground, we know we wouldn't be able to offer the services we are doing without the support. And maybe they are not fully aware, but they are changing life, not only for a woman, but for life in family, life in community, with every woman that they contribute to treat. So we are thankful to them for supporting organizations like Worldwide Fistula Fund that support the work here in Burkina Faso. So we'll be very happy to keep having you supporting the work for treatment, for empowerment, women empowerment. Thank you very much.
Well, we're looking forward to getting future updates from you on how things are going. It sounds like you're right on track to open up, and very excited to hear about your progress. And we'll probably do another one of these soon to see how things are progressing. So I thank you for joining us today. I appreciate it.
Thank you very much, Toya. Thank you.